So for this next exercise, I'm going to show you a mobilization for the hip to help bring the femur back into the capsule if you feel like your femur is pushing on the hip flexor to cause some irritation. So you're going to want to get down into a hands and knees position. I'm going to turn around to where my bottom's facing you, and I'll show you how to do this. Once you're in a hands and knees position, what you're going to do, and let's do our right side first. So what we're going to do is crisscross the right ankle over the left. We're sending our right butt back into a 45-degree angle to where you feel a stretch right in through here. So this is actually the femur pushing back into the capsule. It's going to feel like a glute stretch. You should not have any pain or pinching in the front of the hip. Now to do the left side, you're going to go back to all fours, cross the left ankle over, and we'll send, my left side can go much further than my right. And again, we want to feel everything in the back of the hip. This should feel good. When you're doing this exercise, if you still feel the pinching primarily in the front of your hips, we might need a little extra assist to move the femur back into the pelvis. You can use your thumb, you can use your hand, you can roll up a towel and put a little hand towel or washcloth in between in your hip crease here. Okay, so this is where your femur enters or connects to the pelvis. So if you have hypermobility of your thumb, this might not be the best option for you. Go ahead and use your hands, whatever's easiest. I'm going to do the right. Since I'm on the right side, I'm going to cross my right ankle over, and I'm going to slightly push the femur back as I send my butt into that diagonal direction. I feel less pinching in the front. My right is a lot tighter than my left. I know that I need to work on my right, so I often have to help on the right side. If you don't need to and you feel the good stretch where it's supposed to be in the back of the hip, great, don't worry about this. If you're still feeling pinching in the front, your femur is still hitting the front of your pelvis, and that's called impingement. We have to reduce the impingement. I don't want you to primarily feel this in the groin. If you do, you're not doing it quite right. Try some of those other techniques to help try to encourage push. Move your hip in a different direction. It's about 45 degrees-ish angle. See what feels right for you. For you to be like, oh, that is in the back of my hip. That's where I want you to feel it. Never in the front, in the groin. Okay? This is a really, really great stretch and hip mobility exercise to really get the femur off of the hip flexors to truly solve your problem. See you on the next one.